Welcome to our third session of our digital series with our partners at Walgreens about the Feel More Like You service. We are so excited to welcome Alex Cosimano. Oh, I almost messed it up again. Alex Cosimano, who is our expert for this evening, and he is going to be speaking to all of the pharmacy-related questions, wonderings, that young adults ponder all the time, I'm sure, who are going through cancer. And I am so excited to hear what he has to say, not only just about the service, but then talking a little bit on a broader level about side effects and things to expect. We polled our audience across our social media platforms and got some awesome questions that we will be kind of throwing Alex's way. And you will also have an opportunity to ask any questions you may have to Alex while we have him here live. I do want to let everybody know that this event is being recorded. That way we can send it out to people who are not able to be here live. I think the information that we're going to be chatting about tonight is really important. So we'd love to capture that for anyone who isn't here live. So enough from me. Actually, one more quick thing. I am going to be sharing some really important links in the chat. So be sure to pay attention to those. And as Alex is speaking, if you have any questions that come up, there is a Q&A capability here. So feel free to throw them in that Q&A box. Or if you would prefer to put them in the chat, that is fine too. I can help moderate when we get to our Q&A portion. Any questions, let me know, but I am going to give Alex the stage here. Let me remove.
Oh, thank you so much, Lisa. Good evening, everyone, and welcome to this session about our Feel More Like You program. Let me get my presentation up here for you all. All right, so we're here to talk tonight about Feel More Like You, which is a Walgreens beauty-led and pharmacy-supported service available free of charge at over 2,000 stores nationwide. And what's really wonderful about this service is that it is designed to ensure that patients are being impacted by the internal and visible changes from cancer treatment, are supported and equipped with the tools and empowerment to make them feel more like themselves. So, whoa, I went the wrong way here. Sorry, let me try that again. All right, so start off with a little bit about myself. My name is, of course, Alex Cosimano. I am a certified specialty pharmacist, and I've been a pharmacist for about 15 years. During that time, I spent the last 10 years working first at a academic comprehensive cancer center as an oncology pharmacist, and then for several years as a specialty pharmacist at Walgreens. So during that time, I've picked up expertise in oncology therapies, counseling patients, helping patients with adherence and financial issues with their medication, and advising on prior authorizations and things of that nature. So the reason we're all here tonight, what is the Walgreens Feel More Like You service? Feel More Like You is a unique team approach that helps manage both the internal and the visible or external side effects of cancer treatment and into survivorship. We've specially trained our pharmacists and beauty and wellness consultants at over 2,000 locations to help support you and your loved ones throughout the journey. And like I said before, the service is free of charge. And also importantly, no appointment is needed. You can walk into the Walgreens at any time that it's open to get advice from the pharmacist and seek out that beauty and wellness consultant for external side effects. Also, it's important to note that we don't require any purchase of products during the consultation. So the consultation is really just there to help you and help you learn how to do the different makeup techniques and things that we'll get into in a moment. So from the beginning of designing this program, we knew that we had to get it right. So we wanted to partner up with the experts in the field to make sure that we had the knowledge and skills to make a real difference. And that's why we partnered with Cancer Support Community and Look Good, Feel Better to design the Feel More Like You service. and it's available nationwide. So we have over 2,000 participating locations with over 3,000 beauty wellness consultants and 12,000 pharmacists. And it's very easy to find the nearest location to you. You would just click on walgreens.com/feel more like you, which will provide the link in the chat. And from there, you'll see a blue button that says location service locator, and that will bring you to a screen with a map that you just plug in your zip code, and I'll show you all the locations that are close to your house. So what do we mean when we're talking about the visible changes of cancer treatment? So our beauty and wellness consultants have been trained to provide individualized makeup techniques, tips and tricks, and guidance on what cosmetic products are safer to use to help with all sorts of conditions. So that can include hair loss or dry hair and dry skin discolorations, how to protect yourself from the sun, and changes to your nails or your cuticles, and any other appearance questions or concerns you may have. We've also worked with our pharmacists to train them to provide counseling on over-the-counter products and tips and trips to relieve different symptoms that come along with treatment of cancer, whether that be occasional nausea and vomiting, diarrhea, skin rash, mouth sores, or increased fatigue. So I thought what might be really helpful is to talk a little bit more about what specialty pharmacies provide and tips and tricks on how to work with your specialty pharmacy team. And you can locate one of our over 75 Walgreens Oncology specialized pharmacies nationwide by clicking on walgreens.com and then clicking on the store locator button. And then there'll be a filter where you can select oncology specialized pharmacy to find the one closest to you. So we have a little video that we'd like to share.
Sarah's family is the center of her world. And when she was diagnosed with breast cancer, she became the center of ours. Walgreens surrounds patients like Sarah with care, welcoming them by coordinating financial assistance and connecting them with cancer advocacy resources. And fertility preservation medication and support can help with planning for the future while taking things day by day. Our national network of specialty pharmacies works to fulfill prescriptions within 48 hours so patients can start treatment quickly. Should side effects arise, we're here 24/7 to answer questions and support adherence. And our beauty and wellness consultants know just how to help Sarah look and feel more like herself. Because Sarah is so much more than her cancer diagnosis. Is the center of her world at every step of her journey. And when she was diagnosed with breast cancer, she became the center of ours. Walgreens surrounds patients like Sarah with care, welcoming them by coordinating financial assistance and connecting them with cancer advocacy resources. And fertility preservation medication and support can help with planning for the future while taking things day by day. Our national network of specialty pharmacies works to fulfill prescriptions within 48 hours so patients can start treatment quickly. Should side effects arise, we're here 24/7 to answer questions and support adherence. And our beauty and wellness consultants know just how to help Sarah look and feel more like herself. Because Sarah is so much more than her cancer diagnosis. We'll be there at every step of her journey to bring hope within reach.
All right, thank you for bearing with me for those technical difficulties there. But I hope you all enjoyed the video. And I really love how the video highlights how Walgreens Specialty Pharmacy puts the patient at the center of everything we do. And that really all starts when your doctor sends us a referral or you bring in a specialty prescription to any of our stores nationwide. A team member will then reach out to you to let you know we received the prescription and gather some of your information, like your insurance information, what health conditions you might have and other medications you might take. And that is a great time to ask any questions you have about the specialty pharmacy process and what you can expect going forward. What's also wonderful is that in these over 75 locations we have nationwide with specialized oncology care, the teams are small. So you really get to know your pharmacists and technicians very well. They get to know you, they get to know what's important to you, and they can really personalize that care for you. Of course, if you prefer not to come into our pharmacy, we also have the ability to communicate with you over phone or email. So it's really whatever is best for you. And we also offer free prescription delivery. And that delivery can be either to your house, to your doctor's office, or we can even send to your local Walgreens community pharmacy, different uh, services to mail out those prescriptions. So I'd expect or a courier service. And then medication to educate you on it. You'll hear from us after you start, a week or two later, to make sure everything is going well. And also before your refills come due, to make sure you always have your medication on time when you need it. And please, we always want our patients never to hesitate to reach out anytime they have a question or concern. So we know that during therapy and even before you get started on therapy, a lot of different barriers can come up that can make it difficult to access treatment. Um, our pharmacies and many specialty pharmacies will help support the prior authorization process, which is where the doctor obtains approval for your medication from your insurance company. And we'll help the doctor put together that information and get off to the insurance to make sure your medication gets approved, all the while providing you status updates along the way. We'll also note that when that authorization expires, so that a few weeks before it expires, we can start a new authorization for you, making sure you have that continuity of care. We help with financial assistance. So unfortunately, we know that even once insurance approves a medication, it can still cost into the thousands of dollars. So it's very important, first of all, to make sure that you're using an in-network, specialty pharmacy provider, so that you're getting the lowest cost share available through your insurance company. And then also work with the specialty pharmacy team to provide options on reducing cost for you. We have many different copay assistance options available for eligible patients, and those could include copay cards from the manufacturer, foundations and grants offered by different outside sources, and manufacturer assistance programs. Finally, it's important to note that many medications used to treat cancer were considered limited distribution drugs. And those are medications that are only available through specific specialty pharmacies. And that's really to enable better consistency in the care provided to patients. So anytime you have a question about what pharmacy may offer a medication, or if a medication is available at a particular pharmacy, the specialty pharmacy can help to answer those questions for you. And then the most important thing is that you have a positive outcome with your treatment. So that starts with coordination of care, which is really what we do to prevent gaps in treatment. We have a wonderful connected care program at Walgreens Specialty Pharmacy, where we really follow you step by step through your treatment to make sure you're getting the best results possible. So we'll counsel you at the beginning of treatment, and whenever it's indicated thereafter, and that might be because when you start treatment, to educate you on how to take the medication properly, if it has any special administration requirements or storage requirements, what side effects you might expect, and how to either prevent or ameliorate them should they come up, and any other questions you have about the medication, what to avoid while you're taking it, for example. We'll also do assessments along the way to make sure that the treatment is working as expected, and to monitor for any new things that might come up as far as side effects or other issues that you're facing. Finally, we can provide access to different support groups, different community resources, and advocacy groups that can help you along with your journey. Of course, as I spoke to before, we do discuss side effects before starting the medication with you. And along the way, we'll continue to ask about any side effects you're having, support you through working through those side effects, and then just address challenges with adherence. And when I think of adherence, I think of, how can my patient really fit this medication into their life? We don't want to be that the patient has to plan the life around their medication for you to just have it as part of your daily routine so that you're taking it when you're supposed to and it's affecting you the least possible. So we collaborated with Elephants and Tea to have a special edition about the Walgreens Feel More Like You service, which I was honored to be able to take part in and author an article. And in the article, we just go into a lot more detail about what the service provides during an appointment and why we're doing the service and why we're providing it for patients. So some of the things you find in there are just, we talked about hair regrowth and itchy and dry skin. We'll talk about the importance of protecting yourself from the sun. And I really love the story that we shared about a particular patient I had that was suffering from leukemia. And the medication that she had just started was really interfering with her life. She was someone that loved to go shopping and enjoy life, be outside all the time. And the medication was just making her so tired she didn't even want to get out of bed. So I talked to her. We found out that she was having some hydration issues. So I gave her some tips on increasing her water intake, and that she was taking a very long nap in the afternoons, like several hours. So I talked to her about the importance of really sleeping at night and just taking a short nap when you need to so that the nap wasn't interfering with your sleep at night. So she was able to do that. She was starting to sleep a lot better at night, was able to get out more and she was very pleased with that because she was getting back to her normal life somewhat. Then, unfortunately, the medication started to make her nails brittle. So, what's really special about Feel More Like You is that even though I was in a specialty pharmacy where I didn't have a wide range of over-the-counter products and actually no cosmetic products at all, I was able to connect her with a Walgreens close to her where they offer the Feel More Like You service, and the beauty and wellness consultant was able to advise her on the proper products to use and how to apply them to her nails and give her some measure of relief. So that was really awesome. We also partnered with Elephants and Tea for a cancer fertility issue. And what I really like about this issue is that the stories are from patient and physician perspectives. So it talks to different patients at all stages of the fertility journey, whether it might have been someone that never thought about having a family. It might have been someone that had started a family but wanted more children, or someone that just wasn't sure, do I want a family? Do I want to have kids? And it just, each patient story walks us kind of through their journey through treatment and fertility and what considerations they put into it. And it really helps to explore those issues. So thank you very much. That's it for the presentation. And now I'd like to open it up back to Lisa for any questions that might have come in.
Thank you so much, Alex. That was awesome. So informative. And I did drop the links to a lot of different things. So not only the Feel More Like You homepage on the Walgreens website, but to the Feel More Like You service custom issue. If you have not checked that out yet, please do. And then specifically to your article, Alex, that you had kind of screenshots there, which just has so much wonderful information. And then our cancer and fertility custom issue. I love that that's a part of it, as we know that it really is all intertwined when it comes to young adults experiencing cancer. So definitely check out any of those if you have not yet. I am going to ask if anyone in the audience has any questions, again, to either put them in the Q&A or in the chat. But I am going to start it off with some of the questions we received when we kind of polled our audience, if you will, across our social media platforms. So Alex, one of them was about getting our nails done post-treatment, because we know that when we're going through chemo, we're told again and again, definitely do not go to a nail salon. So maybe could you just speak briefly why that's the case, and then also when would it be safe again to go?
Yeah, sure. So, unfortunately, in addition to causing our hair to fall out a lot of times, or our nails to fall off, a lot of different chemotherapies affect our immune system and can really lower our ability to prevent and fight off infections. So most of the recommendations are really in the vein of we know that nail salons, a lot of people are very close together. It's very easy to spread disease. And then we never know how clean, unfortunately, the tools and everything are, right? So really, I think there's two different situations to kind of think about here, right? We have, if you're if you were being treated for a solid tumor and your treatment finished, you are in remission, and you've gone back and had blood work done and your counts are back up to normal, which usually takes a few months, maybe 3 to 4 months, right? It's okay then, once your counts are normal, with your doctor's permission, to go to the nail salon. In the meantime, of course, you can still do your nails at home once they start to grow in, and we can even point you to the better nail products, especially like nail polish remover products that are not going to dry you out your skin as much while you're still in that kind of sensitive phase. But on the other hand, if you were suffering from a hematologic disease where you might have gone through a transplant, that process of immune reconstitution takes much longer. It can be up to a couple of years, right? So it's really important in those cases, especially, those patients will be very prone to getting new infections and whatnot while their immune systems are regrowing, and you have to get revaccinated and everything. So we really recommend those patients wait, depending on the type of transplant and everything, could be up to 2 years or even longer until the immune system has reconstituted.
Awesome. That is so helpful. And Liz just said in the chat that putting on like a vitamin infused clear coat was really helpful. So I was actually thinking that as a follow-up question is, do you agree with that? Do you think that that's a great alternative to kind of do to help our nails re-strengthen?
Yeah, a clear coat is great. The vitamin infused, you just want to be careful that it doesn't have too many different I don't want to say that it doesn't have too many different vitamins, but it just doesn't have too many different additives that can sometimes dry out the skin, or different fragrances and stuff that can be more irritating. So you just want to be careful with the products that you're selecting. But yeah, there's no issue with that.
Awesome. And then I have another follow-up because I am now almost 6 years out from my treatment, and I still find my nails to be very brittle. And I'm wondering if there are like specific vitamins that you would
Mhm.
recommend or anything that I should maybe be focusing more on.
Yeah, so biotin can be very helpful for nail growth. Once, of course, after treatment is finished.
Yeah.
And then even like some collagen products that they sell, the powders that you can mix into a drink or whatnot, can be helpful as well.
Oh, great. Yeah, I feel like collagen products are kind of all the craze right now. So
Yeah.
thank you. Another question came in about hair loss and thinning post-treatment. So
hmm
like in survivorship, is that something that you see commonly, and kind of what can we do about it, if anything?
Yeah, this is a great question because we all know that hair thinning loss is common during treatment, right? Um, but we don't talk about it as much what happens during survivorship. So most patients are going to start to regrow their hair within 6 to 8 weeks of finishing treatment. But depending on the type of cancer and the type of treatment that you've received, up to 1 in 3 patients may not have full hair regrowth. They might still experience some hair thinning or loss. So some of the treatments that are more likely to cause ongoing symptoms would be any radiation therapy to the head or neck area, or any area where you're concerned about the hair regrowth. Unfortunately, the radiation therapy really does a number on those follicle cells, and it makes the hair regrowth very difficult. And then there's certain types of chemotherapies that also are more likely to cause ongoing hair thinning, such as Taxotere, or combination treatment with what's called a taxane, which Taxotere is one of those types of medicines, also Taxol, and then anthracycline, which the most common one is probably adriamycin or the red devil, right? So those are some of the different chemotherapies that can cause ongoing hair symptoms. Also, patients that are taking hormonal therapy, especially like, let's think about after breast cancer per se, um, to help prevent it from recurring. Those will often also cause hair thinning, and those are medicines like tamoxifen or aromatase inhibitors like aromacin or letrozole. And when those medications are taken in combination with targeted uh, treatments like Verzenio or Ibrance um, for breast cancer, for example, it's even more likely to cause some hair thinning. And then the other case I want to just briefly touch on is if you were the recipient of allogeneic bone marrow transplant, a bone marrow transplant that came from another person, something that's very common and can go on, either right after you receive your transplant or may not occur for months to years later, is called graft versus host disease. So if your hair grew back in normally and then all of a sudden you're starting to notice that it's getting patchy or thin, or you're starting to have a lot of irritation in your scalp, that is a good call out to go see your oncologist or give them a call and let them know what's happening, because that could be the beginnings of graft versus host disease of the skin.
Oh, interesting. That's so helpful. Thank you, Alex. And it's
Mm-hmm.
funny, as you were listing off all those chemotherapies that can have like ongoing hair treatment, I had two of those and I did not know that they could cause ongoing hair issues. So I'm even learning so much right now. So thank you for that. We had a question in the chat. Which is better for the skin, oil or lotion based?
Yeah, so we normally recommend it's like a bio oil, I think is what they call it. And that's going to help keep the skin moisturized and also protect, because that oil is going to form like kind of a protective layer at the top of the skin.
Oh, awesome. Great. Thank you for asking that question, Shakita. Any other questions? Keep putting them in the chat. I am going to ask another one of mine. Oh, a common one that we got was hot flashes. When will they go away? Will they go away post-treatment? Because I know a lot of, at least my friends, are kind of still dealing with those post-treatment.
Yeah. So this is another one of those situations, and this like very common in pharmacy. We have to always say it depends, right?
Right.
So one of the things that happens when you're on chemotherapy is that it can cause a temporary menopause. So that, of course, will be associated with hot flashes, and it may take from several months to up to 2 years even after completing chemotherapy for that temporary menopause to kind of cease, for the normal ovulation to start occurring again, and the hot flashes to hopefully at that point go away. Unfortunately, though, especially for women who are nearing menopause before starting chemotherapy, that temporary menopause can become permanent. And your doctor can actually do blood work to help determine if that's the case. Once again, women who are on hormonal therapy for breast cancer with medications like aromatase inhibitors and tamoxifen, or any type of cancer that's hormone sensitive, they will continue to experience the hot flashes while they're on the medication. And if for some reason you had to have an oophorectomy and have your ovaries removed, that will also put you into menopause. So that would cause the hot flashes to continue as well.
Okay, that all makes sense. Liz made a comment about eyebrows and lashes and like body hair. And I feel like you don't often always think that those will be affected long term as well.
Yeah.
But yeah, I'm assuming it does, especially because Liz is saying that she's experiencing that as well. So is that
Yeah.
also pretty common?
Unfortunately, yeah, I think a lot of the times when we think of hair falling out, everyone's so focused on the scalp because that's what's the most visible,
Right.
the first thing that hits people. But yeah, it really can affect hair anywhere on your body, whether that be eyebrows, lashes, in private areas or whatnot. So,
Okay. What about dietary restrictions while
mhm.
on medications? And again, I'm sure that it varies depending on the medication, but I think some of the common things people were asking about when we asked was caffeine or alcohol. Can you just speak to any restrictions that people may have or want to follow?
Yeah, so as a pharmacist, I really recommend trying to avoid alcohol while you're on treatment. And a couple of reasons behind that. One, alcohol reduces your immune system's ability to fight off infection. Two, it's upsetting to the stomach lining, which is, unfortunately already going to be kind of wonky from the chemotherapy, and it's going to contribute to more nausea and upset stomach and just feeling kind of nasty in that area. And then three, it affects your liver, right? And your liver is so important in helping to process out these poisons that we're giving as chemotherapy to patients and to get those out of the body so that they're not continuing to cause side effects. So, it on a case by case basis, if if you're having an important event and you want to have a glass of wine, definitely ask your doctor or pharmacist that's familiar with your particular case and your medications if it's okay for you. But as a general rule, I would try to avoid it. Caffeine, similarly, is going to affect your stomach and can cause acidity and everything, which is going to make those stomach side effects worse for you. So I wouldn't say it's as strong of an avoid as caffeine, but maybe just try to moderate and, minimize your intake as much as possible. And then, of course, many different medications are going to interact with different foods and supplements. So you should be getting that information from your doctor or pharmacist when you're starting a new medicine. But if you're not, please ask. Even if they don't proactively offer it, don't assume that that means it's okay. Please ask. And then anytime you want to start a new supplement, we actually have a great resource at Walgreens where we can check different natural supplements against drugs for interactions. We can check actually to see like, well, I heard from so and so that this was good for whatever. We can actually see if there's been any scientific studies done to support that, to actually put some credence behind what you may have heard or what might be advertised on the internet or whatnot. So that's a really great resource we have for patients too.
Oh, I love that so much. And I know other young adult survivors out there and patients, we hear so often from people like, oh, try this. I heard this worked for so and so. It's constant. So that's really cool that we can come to you all, the experts, and have you fact check it for us. That's great. Yeah, acid stomach was one of my worst symptoms. I feel like chemo just totally ruined my gut for a while. I'm wondering, I have a follow-up question. Are there things that people going through treatment can do to kind of support their liver, let's say, while they're kind of undergoing chemotherapy? Are there things that we can do to kind of like help offset anything?
Yeah, I think it's the most important things are going to be and there's not necessarily to support the liver or whatnot, but to stay hydrated.
Mhm.
I know someone brought up some being dehydrated in the chat, and yeah, it's terrible. Most of us probably are dehydrated at some level to begin with, unfortunately. And then, of course, the chemotherapy and all the things that go along with it make it much worse. And that's going to just help make sure that all your stuff in your body is functioning the way it's meant to. It's going to make sure that you have enough blood flow to get your liver and your kidneys processing out the things that you need to process out. I think it's important to try to maintain a well-balanced diet. We know that when you start chemo or any of these cancer-fighting medications, your taste can really change. You're going to react differently to foods than you're used to, but whatever you can do to maintain that well-balanced diet, maybe it's adding some different seasonings, maybe it's, trying different foods or eating smaller portions, but just trying to make sure you're getting in all that nutrition that you need. Um, Someone just asked, are there any vitamins or supplements you should avoid while on chemo? And that it really just depends on the chemotherapy you're taking. So a lot of them will mess with your iron levels, your magnesium levels, or whatnot. So your doctor may recommend to take certain supplements or avoid certain supplements, but it's a great question to ask on a case by case basis with your pharmacist or your doctor.
Awesome. Thank you so much. Let's see. Oh, this was a really good one. Medications can be very expensive. How
Mhm.
can I find out if there are generic versions of medications that I'm being recommended to take? What is like the best way to go about that?
Yeah, so that's a great question for your pharmacist. And what's actually kind of surprising is they're not always the cheapest, right? So it really kind of depends on your insurance and your where you're receiving treatment, what their formulary is and whatnot. But what your pharmacist can do is discuss what generics might be available for traditional medicines. And now a lot of patients are on what are called biologic medications, which are some of those newer targeted therapies, and rather than having a generic, it's called in the pharmacy lingo a biosimilar, which often those could be more expensive or the same price about as the original product that you would have been given. So what we can do is actually work with you and your insurance to find out what is the most cost-effective option for you. Does the insurance cover both the brand and the generic, or do they only cover the brand? Do they only cover the generic? And then what manufacturer programs or other foundation support is available for the different drugs? So, for example, a patient may end up paying less for a brand because it has a copay support program from the manufacturer, whereas the generic most oftentimes will not. So it's really important to find out if there's a generic or biosimilar available, and then what your costs will be for each one, not just to presume that one will necessarily be cheaper than the other. And the pharmacy is a great resource for that.
Oh, that's such a good point. I feel like I wonder if anyone else is assuming that, but I just assumed generic meant cheaper. So that's very interesting that it's not always the case. Thank you for clarifying that. And you kind of touched upon this a little bit in what you just said, but can you speak to any other financial resources? I know you spoke to it a little bit in your presentation as well. That's clearly a topic and an issue that is top of mind for young adults going through cancer treatment. So any information you can provide would be helpful.
No, definitely. So I think the first thing is getting it covered by your insurance. So most of these medications will not be covered by your insurance off the bat. It will require a special approval. And what we'll do at the specialty pharmacy is work with the doctor's office to determine what needs to be submitted to get this medication covered. Is it, are there specific labs that need to be submitted, a specific diagnosis or imaging or whatnot? What did you have to maybe try before this new, this current medication will be covered? Because some of them require what's called a step therapy, or that several medicines be tried and failed before another one will be covered. And we'll work with the doctor to get all that information together and send off to the insurance company. Once the insurance approves it, we can see, okay, what will the patient's responsibility be, if that's a copay or if it's a certain percentage or whatnot. Does the patient have a deductible to meet? Because oftentimes that can greatly influence what the cost of the medication will be. And what will the cost look like going forward? So we'll see like what the cost is for that first fill, but then oftentimes we can also kind of estimate, what you would pay over the next several months as well. Once we know that, we'll look into different manufacturer copay programs. Most young adults and adolescents with cancer will probably be on commercial insurance or Medicaid. So if they're on commercial insurance, we'll look at the different manufacturer copay programs and see what we can apply for you from there. And many of those programs can be very generous. So some of them may cover, $10,000 a year of treatment costs, $12,000 a year, and things of that nature. Some of them may not. And then if that's the case where it's still not where it's affordable for everyone, and that can be very different for different people, right? Some people may not be able to afford a $5 copay. Some people may be able to afford that, but not be able to afford a $500 copay. So we'll look at different foundations like Cancer Care and HealthWell, and there's a whole bunch of them out there that we have access to that can help to pay those copays or any remaining costs left for the patient. And it's important to know here too that if you're an uninsured patient, many of those foundations will help you to get money to pay an insurance premium, so you can actually get insurance that will cover more than just the actual treatment itself. So that's also something to consider if you don't have insurance. If all of that fails, then we work with the patient, and if they have a social worker at their cancer treatment center, to enroll them in a manufacturer support program where the manufacturer will actually provide the drug at little to no charge to the patient.
Oh, wow. Oh, that's incredible. It sounds like you all really take it from like the first step all the way through and really like help and walk the patient through everything. And that's just to know that we have that resource and that support is so huge. I wish I had known this existed when I was going through treatment. So thank you for answering all of that. We had actually, I'm going to put this link in the chat again for anyone who missed it. But if anything that Alex is saying is ringing any kind of bell, visit that page and click the store locator and find the nearest one to you and get this process started, because it sounds just like an incredible resource. Shakita asked, are there any patients undergoing active cancer treatment who should not get vaccinated for COVID-19?
Yes, that's a great question. Um, we don't have specific studies in cancer patients, right, to say whether any vaccine really is safe or unsafe. So the best thing to do is to discuss it with your oncologist, because a lot of things are going to go into that decision. What chemotherapy are you getting? What your current blood counts are? You know, if your immune system is so low that you don't have the blood counts to support, you know, making new antibodies and everything from the vaccine, it's not really going to help you, unfortunately, right? And we wouldn't want to give a vaccine to a person in that situation. So it's really a great question to ask your oncologist. There's nothing to say that it's not safe for patients, you know, and with cancer specifically, but it really just depends where you are in your treatment and what your whole overall picture looks like.
Thank you. That's helpful for sure. Um, somebody had asked, and it's a pretty broad question, but I'm just wondering if you can speak to it at all. Someone said, how much is my treatment going to impact my long-term health?
That's a great question too, and it really depends on what your treatment is involving, and what you know, what type of cancer you have and whatnot. So um, some cancers are chronic, like chronic leukemias, where you might be on treatment for years, you know, all the way up to the rest of your life. Um, so that's going to continue, of course, impacting your health. You know, usually those treatments are not as you know, I don't want to say they're not as side effect prone, because they are side effect prone still, but they may have side effects that are more easy to adapt to in many patients than other chemotherapy is. And then just depending on what type of cancer you have, a lot of the chemotherapies we use, unfortunately, can cause other cancers to come back years down the road. And we're getting better at, you know, monitoring for that, and we're getting better treatments every day, really, that may not have these long-term effects, and they're being tested to see what's the best treatment in the long run for patients. But you know, a lot of this work is still ongoing, so it really just depends. You know, there's wonderful cases where patients will go into remission, be declared cancer free, and within a few years after treatment are feeling back to their normal selves. But that's, you know, unfortunately not the case for everyone.
Yeah, absolutely. I remember that I was told that a lot of the chemotherapies that I went on could be damaging to my heart. So I know
Hmm.
that like your oncologist will most likely speak to any larger side effects like that. And I remember I had to go and get like echocardiograms done every few weeks or so just to keep an eye on that. But um yeah, it's good to know that it can get better, and obviously it does depend on the treatment that you are experiencing and undergoing.
Yeah.
Any other questions from our audience? You guys had some awesome questions. Oh, here's another one. There are so many discount saving cards online for medications for uninsured patients, but you have to hunt for them. Is Walgreens aware of these saving? And if so, why are they not passed on to the patient? That's a great question.
Yeah, that's a great question. So actually, we have partnered with a lot of those discount cards, and we now offer in our pharmacies, Walgreens, I believe it's called Walgreens Savings Finder. But what it is that the pharmacist can then go into this program, look up the medication you're on, and see which discount card actually provides you with the best deal, whether it's from, you know, there's so many out there, but like GoodRx, let's say, or there's too many to name, but it looks at a bunch of them to figure out which is the best, and then also your insurance. So it really just depends on the medication, um, and what your insurance coverage is. Unfortunately, for cancer medications, because most of them are so expensive, your insurance will usually be the best option. So that's why we normally stick to that for the cancer medications.
Okay, but Walgreens, you said
I
Walgreens,
think it's called Walgreens Savings Finder.
awesome. Wow, Walgreens has an answer for everything. I love it.
Yeah, we're
Okay,
trying.
it's awesome. Oh, thank you, Lolly.
Thank you, Lolly.
Great. Any other questions from our audience? This was so helpful.
So we didn't really get to touch on too much, but I just also wanted to mention we've recently implemented in our counseling fertility intervention for eligible patients. So if you are with Walgreens Specialty Pharmacy and you're starting a new cancer medication, you're someone that may be eligible for fertility preservation, we'll talk with you about that on that first phone call where we talk about your medication, kind of introduce the services to you, and we can point you to services that can help with the fertility preservation if it's appropriate in your case. We also have available through our Walgreens app for anyone that's interested. If you download the Walgreens app and then click on the Find Care icon and then go to Cancer Care, there's a program called Kind Body, which offers fertility consultations and can even start a patient the same day with an appointment to see a provider.
Oh, that's awesome. Thank you so much for sharing that. Great. Well, Alex, I speak on behalf of the entire Elephants and Tea team, and not just you, but the whole Walgreens team that we have worked with, not only on this custom issue, but the digital series to help kind of support it and get this information out there. Because like I said, it's incredible the work you all are doing. We are so, so thankful. So thank you for being here and for sharing your amazing knowledge. And we will get this recording out to everybody who was registered so that they can learn and hopefully benefit from this service. So thank you for taking time out of your day and being with us here tonight.
It was my pleasure. It's been great speaking with everyone.
Awesome. And thank you all. If you decided to take some time out and join us tonight, thank you so much. We hope you learned something. Be on the lookout for the recording. And this has been a really amazing digital series. So thank you. Thank you so much for being a part of it. And we'll see everybody later. Bye, everyone.
Thank you. Good night, everyone.
Thanks, Dylan. Thanks, Liz. Awesome. Thank you so much, you guys.
Welcome.